Welcome back. Today we will see the topic Autocoids and Related Drugs, and in that we will learn the chapter Histamine and Antihistaminics. So first let us see what we understand by the term autocoid. The term autocoid means self-healing substance or self-remedy, and this term is derived from Greek word autos, which means self, and eikos, which means healing substance. So these two terms give rise to autocoid, and which means self-healing substance and self-remedy. So what are they? What are these autocoids? So these are substances that is produced in our body, that is produced by wide variety of cells in the body, and they have intense biological activity, but they generally act locally, that is only at the site of synthesis and release. Since they act locally, that is at the site where they were synthesized and released, they are also called local hormones. Even though they are called local hormones, they differ from hormones in two important ways. Let us see what are they. First, hormones are produced by specific cells, but this autocoid is produced by wide variety of cells. So that's the first difference between autocoid, which is called as local hormones, and hormones that are produced in our body. And next one is they are transported, that is hormones are transported through circulation to act on distant target tissue. So we know that hormones can act on target tissue that are located at a distance in the body, whereas autocoids act only locally, that is at the site of synthesis and release. So that is the second difference between autocoid and hormones. The types of autocoids that are present in our body are amine autocoids, then lipid derived autocoids, and peptide autocoids. First let us see amine autocoids, and they are histamine and 5-hydroxytryptamine, which is generally called as serotonin. And next is lipid derived autocoids, and they are prostaglandin, leukotrienes, platelet activating factor. And finally, peptide autocoids are plasmakinins, that is bradykinin and kallidin, and angiotensin. And in addition to the above mentioned autocoids, there are cytokines and several peptides like gastrin, then somatostatin, vasoactive intestinal peptide, and they are also considered as autocoids. Next, we will discuss about histamines. This is an introduction about histamine. First, let us see what the term histamine means. It means tissue amine, because the term histos means tissue. So histamine means tissue amine. So where it is present? We can find this histamine in animal tissues and also in certain plants. Example for that is stinging nettle. And next is how it is stored. It is stored within, usually it is found in mast cell, within the storage granules of mast cells. So this is the mast cell, and within the mast cell there is storage granules, and within the storage granules we have histamine being stored. And the tissues that are rich in histamine in our body are skin, lungs, liver, placenta, and gastric intestinal mucosa. We have said that usually this histamine is found within mast cell, but there is an exception, because non-mast cell histamines are also there, and they are present in brain, epidermis, and gastric mucosa. And we can find histamine in blood, then most of our body secretion, venom, and also in pathological fluids. Now let us see how histamine is synthesized. Histamine is synthesized from the amino acid histidine. By decarboxylation of histidine, we get histamine. And this histamine will be degraded by oxidation and methylation. Now let us study about the storage of histamine. We learned that histamine is stored in the mast cell, but how it is stored, let us see. So we know that histamine is found in the granules that is present inside mast cell. So within that granule, histamine is positively charged. Okay, so this positively charged is held by negatively charged acidic protein or negatively charged heparin. This is how histamine is stored within the granules that is present inside mast cell. And when exocytosis happens, these granules have just enlarged it. Okay, so these granules will be forced out and sodium ions which is present in the extracellular fluid, they will exchange with histamine in order to release them free. This histamine will be released. But if there is an increase in intracellular cyclic AMP, histamine release will be inhibited. And please also note that this histamine is inactive orally because liver degrades all histamine that is absorbed from the intestine. Next is histamine receptors. Histamine receptors are H1, H2 and H3 and H4. This H4 was found later in the year 2001. H1 histamine receptors are found on smooth muscles, that is in intestine, airway, uterus, smooth muscles, then blood vessels, brain and adrenal medulla, and H2 receptors are found in gastric glands, heart, uterus and brain, whereas H3 receptors are found in lungs, spleen, skin and ileum, and H4 is found in intestine and brain. This H1, H2 and H3, they are G protein coupled receptors. Next, let us see the pharmacological action of histamine in blood vessels. In blood vessels, they cause dilation of smaller blood vessels, including arterioles, capillaries and venules, whereas it causes constriction of larger arteries and veins. So that is the action of histamine in blood vessels. Next, if it is injected intradermally, they show triple response, which consists of red spot, wheal and flare. This red spot happens due to intense capillary dilation, and wheal, this response will happen due to exudation of fluid from capillaries and venules. That is, fluid starts to come off or ooze out from the capillaries and venule if they are injected, if histamine is injected intradermally. Then finally flare, that is redness in the surrounding area, and that is also due to arteriolar dilation. And please note that this constriction of larger arteries and veins by histamine is through H1 receptor on vascular smooth muscles. Next is pharmacological action on heart. Direct effect of histamine on in situ heart, that is heart which is in its original place, are not prominent, but a heart that is isolated, especially the heart of guinea pig, is stimulated. So histamine causes stimulation of heart, especially isolated heart of guinea pig. Next is its action on visceral smooth muscle, and it acts on smooth muscles of bronchi and causes bronchoconstriction. Then next is its action on glands. They act on gastric gland and cause a marked increase in the gastric secretion. Next is histamine's pharmacological action on sensory nerve endings. They stimulate sensory nerve ending. And when histamine is injected IV or intracutaneously, itching occurs. And when higher concentration is injected and more deeply injected, they cause pain. So both these are the reflection of the capacity of histamine to stimulate sensory nerve endings. Next is its action on autonomic ganglia and adrenal medulla. Both autonomic ganglia and adrenal medulla are stimulated by histamine, and also release of adrenaline occurs. And this release of adrenaline can cause secondary rise in BP, or we can say secondary high blood pressure. The secondary high blood pressure is caused by another medical condition or disease like kidney problem, obesity, pregnancy, sleep apnea, etc. are the reason for secondary high blood pressure. Next is action on CNS. Histamine does not penetrate blood-brain barrier, so there is no central effect. Next is pathophysiological role of histamine. That is role of histamine that causes functional changes in the body. First one is in gastric secretion. Histamine mediates hydrochloric acid in the stomach. That is, they increase hydrochloric acid secretion. That's the one role. And next role is in allergic phenomena. They mediate hypersensitivity reaction. Third role is as a transmitter. As a transmitter, histamine initiates the sensation of itch and pain at sensory nerve endings, and also as a transmitter, they regulate body temperature, then hormone release from anterior pituitary, then thirst, cardiovascular function, etc. Next is their role in inflammation. They are a mediator of vasodilation and other changes during inflammation. Next role is in tissue growth and repair, because this growing and regenerating tissue contain high concentration of histamine. It is suggested that this histamine play an essential role in the process of growth and repair. And final one is headache. Histamine is implicated in certain vascular headache, but there is no conclusive evidence for that, but it is just an implication. So next one is histamine releases. Various mechanical, then chemical and immunological stimuli can cause the release of histamine from mast cell. So let us see some of them. Tissue damage can cause release of histamine. Tissue damage like trauma, then stings and venom, etc. can cause release of histamine. Next is antigen antibody reaction involving IgE antibodies. They are also capable of histamine release. Then polymers like dextran, polyvinyl pyrrolidine PVP, then basic drugs like tubocurarine, morphine, atropine, vancomycin, etc. Finally, surface acting agents like twin 80, compound 40/80, etc. Please note that histamine has no therapeutic use, but in the past it was used to test acid secreting capacity of stomach, then bronchial hyperreactivity in asthmatics, and for diagnosis of pheochromocytoma. But these pharmacological tests are risky and now it's obsolete. Now we are going to study about antihistaminics. That is the one that opposes the action of histamine. So this H1 antihistaminics, they are termed as the conventional, or they are known as the conventional antihistaminics. These H1 antihistaminics competitively antagonize action of histamine at the H1 receptors. So H1 antihistaminics are classified into highly sedative, moderately sedative, mild sedative, and second generation antihistaminics. First, let us see the drugs that comes under highly sedative class. They are diphenhydramine, dimenhydrinate, hydroxyzine, and promethazine. Next, under moderately sedative class are phenyramine, cyproheptadine, meclizine, buclizine, and cinnarizine. Then under the class mild sedative, the drugs are chlorpheniramine, dexchlorpheniramine, and cyclizine. And second generation antihistaminics are fexofenadine, cetirizine, levocetirizine, and rupatadine. Next is pharmacological actions of antihistaminics. First one is antagonism of histamine. We know that histamine causes bronchoconstriction, then contraction of intestine and other smooth muscles, and also they cause triple response. All these action will be blocked by antihistaminics. Next is histamine will produce a fall in BP at low doses, and that will be blocked by antihistaminics. And histamines will cause release of adrenaline from adrenal medulla, and that action is abolished by antihistaminics. And finally, the constriction of large blood vessels by histamine is antagonized by antihistaminics.
So next action is antiallergic action. So antihistamines controls allergic reaction caused by histamine like urticaria, itching, and angioedema. Urticaria is a kind of skin rash, and angioedema is the painless swelling under skin. Next is action on CNS. Drugs like promethazine and few other antihistamine reduces tremor, rigidity, and siluria of Parkinsonism. Siluria is excessive salivation. And then this H1 antihistamines can effectively prevent motion sickness. But excitement and convulsions are frequently seen at toxic doses of antihistaminics.
So the next pharmacological action is anticholinergic action. This H1 antihistaminics antagonizes the muscarinic action of acetylcholine. Then next is local anesthetic. Antihistaminic possess local anesthetic property, but they are not used clinically because they cause irritation when injected subcutaneously. Next is BP. On IV injection, antihistaminics cause fall in BP, but this is not evident when they are given through oral route. Next is side effects and toxicity. So the side effect that is associated with first generation antihistaminics are frequent, but they are generally mild. And in some cases, tolerance to side effect develops on repeated use. Let us see what are the most common side effects. Sedation, then diminished alertness and concentration, lightheadedness, motor coordination impaired, then fatigue, tendency to fall asleep, epigastric distress, headache. So these are the most common side effects associated with the use of antihistaminics. Since these much of side effects are present with antihistaminics, a patient or patients who use these drugs should be cautioned not to operate motor vehicles or machinery that require constant attention. Next is second generation antihistaminics. The second generation antihistaminics are those H1 receptor blockers marketed after the year 1980, which have one or more of the following properties. They are higher H1 selectivity, so no anticholinergic side effect. Then absence of CNS depressant property, and they have additional antiallergic mechanisms apart from histamine blockade. And principal indications are they are used in allergic rhinitis and conjunctivitis and hay fever because they control sneezing, then runny nose, red watering, itchy eyes, but they do not control a blocked nose. Okay. Then they are used in urticaria, dermographism, atopic eczema, and also they are indicated in acute allergic reactions to drugs and food, but they have poor antipruritic, antiemetic, and antitussive actions. Next, let us see the uses of antihistaminics. Antihistaminics are used to treat allergic disorders, common cold, motion sickness. In milder type of motion sickness, promethazine, diphenhydramine, dimenhydrinate, and cyclizine have prophylactic value, and they should be taken 1 hour before starting of the journey. Next, they are used to treat vertigo, and cinnarizine is the medicine which is used, and they are used as pre-anesthetic medication and also used to treat cough. We can find chlorpheniramine, diphenhydramine, and promethazine as a constituent in many cough remedies. They don't have selective cough suppressant action, but they afford symptomatic relief by its sedative and anticholinergic property. Next, it is used to treat Parkinsonism, and they provide a symptomatic relief in early cases, and that too is based on its anticholinergic and sedative property. Finally, they are used to treat acute muscle dystonia. Thank you for watching. Meet you in the next class. Bye.